day to you all. This is Holly. We have Tommy from Debunking. Sati bhai pani kan apni hanke moi ekta kotha jana mon ase. Itu moi pra Akram Ali la interview la to. Itu enika cases society te enika cases ami kan la majite bishi hoye gina ase. Holi bi higher authorities kan na jane na thaka. To itu karne ami itu case to highlight korala ase aru highlight korise and by the grace of God medical department kan bi aru concerned authority kan bi itu case ke seriously lui digena investigate korina ki karne ase tahan bisari dia karne ami bishi dhanyawad jana ase CM office te bara moke matishe to moi CM office te jaise tahan ke kotha korise aru moi medical department kan ke age par bi lok koro mon takse because ami khan la ite itu negative response negative khan la aha kan reactions itu side effect ha kan society te manu khan dikisho gole to bishi ase ekjon ke share kori thake hole be kun bi jaigina government ke inform nokore hospital de jaigina itu karne ase nokoi bimar to vaccine karne hoise ya kiba nijor la experience na ami khan lo manu khan ki experience kore ase itu kina kore na bimar hoise kile to kina solution pabo itu khan bi takhan doctor khan lote na jaina koi thakise hole bi nijor majete circulate kori na thakise ki moi loti tu she gonna Facebook te obi Instagram te obi last time mo kwanch na enika circulate bishi hoi na thake to moi tu khan la clarification moi lagi thakise medical departments para bi moi be ekta citizen ase aro itu enika society te hoase kule to moi la bi close ne enika society te hoase kule to আমি এনেকা সোসাইটি তে হসে কলে তো ইতো তো ঠিক নহয় আৰু ইতলা সলিউশন উলাবলে লাগে তো মেডিকেল ডিপার্টমেন্টস খান কি বি মলো করমন থাকছে তো টাইম দে হি সিএমও খান para মুকে অফিস তে একবার আইবি গইছে তো অফিস তে যাই না সিএমও খান কি বি লো করছে at some point of time they feel that I have misguided the public খান কে misguide করিছে নে আবি ভাবনা করিছে পারে হলিবি আমি তো হাইলাইট করিছে I have almost clearly said to them মই হাইলাইট করা লাসি কেস তো মানুকে মই প্রায় তো স্টেটমেন্ট এটো প্যারালাইজ হইছে না স্টেটমেন্ট তো ধ্যান হই and as a concerned citizen ami to kitu case ke highlight korine case ke story itu case ke cover koriye na thakise to ami simon ki koise takhange etu takhan par case study korina ase kule to ekta interview session koro ta ekta interview session koro takhan lote to apni an ki dikise itu ekbar moi ke koi dibi aro itu public khan ki bi doubts clear kori dibi ki enika kiba kibi hoise kule to vaccine la piche de kote modot karne jabo ya enika kiba kibi hoise kule to precaution ki lobole lage itu khan karne ami takhan ke kotha koise holi bi like takhan olo busy ho ja karne to tai interview to dibo para nai aru moi takhan para itu moi aru itu brother Akram to paralyzed ha to takhan para kwa to itu underlying disease karne hoise enika koise underlying disease karne hoise na kwase to ami itu takhan la kotha to honi loise hole moi aru ekta janibo mon takha to taila report khan to tai mo ke dikhaise holi moi takhan doctor khan lote ekbar interaction koribo karne to public ke aware create koribo karne takhan ke interact koribo mon actually takhan time dibo para nai to takhan par moi ke Dr. Clement ke jaina log kori sabi aru ki bi details janibo mon ase tai lote hudi lobi aru ina korina update kori dibi kwa karne moi Dr. Clement ke log korole ja ase Dr. Clement to brother Akram Ali ke treat korala doctor ase ala ase referral hospital la doctor ase to mohan eta tai ke jagen tahan ke tai ke jagena interaction koro lop ekta itu details para janibo to ki karne enika hoise brother Akram Ali to vaccine lo karne paralyzed hoise na ya tai itu taila underlying disease karne ase itu doctor pa treat korse to taila statement huni na makan janibo okay so stay tuned here we go We've reached referral hospital now. Guys, I have reached referral hospital right now and he is Dr. Clement. He is the one who have treated Akram Ali. So we will speak to him and we will try to find out what actually happened to Akram Ali. In the previous video, you all can see that Akram Ali's wife, she was claiming that her husband got paralyzed because of the vaccination. So let's know from doctor what he wants to say about that statement. So here we go. So, sir, Akram Ali is your patient, right, sir?
Yeah, he got admitted for 1 week and got discharged.
Okay, right. For 1 week he was admitted here in the hospital,
yes,
right?
Yes.
Okay. So, as per the statement made by his wife, that that his husband got paralyzed because of the vaccination. So, what do you want to say about that? Since you have treated him.
Yeah. After they reported to our hospital, we took history in the emergency department. As their family communicated to us, patient is a known diabetic for more than 1 year, then also hypertensive. Then he was not taking any medication for that.
Okay.
So he presented with in a semi-conscious state with seizures and unable to talk. And this has evolved over 1 week prior to coming to our hospital.
Okay.
Yes. So it was reported that on 12th of July he took the vaccine, and maybe 2-3 days after that he had this episode at home. Then ultimately after 1 week he reported to our hospital. We did necessary investigation, and on CT scan there was a bleeding in the brain, for which he developed all these symptoms.
Okay.
Now, it is also told by the relative that he had similar problems in the month of June. It is recorded. It is must be his family member. In the month of June, he had some seizure episodes.
You can see that in the report, or which family have mentioned that?
So we will record what the family members tell. No? Yeah. Because history is what the nearest relative who is there in the examination during that time gives us. It is the relative who gives us the information. So he had some problem a month before he had this stroke. And diabetic, hypertensive, it is not under treatment. They are always high risk for developing brain bleeding. No? So that must have been the cause for him.
Okay.
And in the meantime, he might have taken injection. And injection, as for us also, we have got some very minor symptoms of body ache, fever, which we take paracetamol and it goes off.
Yeah. Okay. So because it's clearly it says the report is clearly stating that Akram he didn't got paralyzed because of vaccination. He got paralyzed because of the underlying disease. That's
underlying disease which was not treated.
Okay.
He was not taking treatment. He was an auto driver, which is a stressful life. No? So had he taken proper treatment, perhaps this could have been avoided. But he has come for follow-up here, and last 3 days back he has come and he is improving. This is a stroke which is got a high chance of improvement, and he is improving.
Okay, that's really good to know that he is improving. So, sir, just wanted to confirm from you the last one thing, that is like you're saying that this he didn't got paralyzed because of the vaccine, because of the underlying disease. So, want to ask one question, that is, for this kind of Akram kind of people who are living in stress, who are living with this kind of diseases, there are a lot of problems in human body that sometimes we don't get time to identify those things also. So is it okay for those people to come and take vaccine without consulting to doctor what kind of problem they are facing? Without consulting to doctor, is it okay to take a vaccine straight away like that? If somebody, after taking the vaccination, if they become sick, then they are accusing the vaccine only. No? So what do you want to say about this matter?
See, right now, as put up by World Health Organization and also Department of Health and Family Welfare, vaccine can be taken by ladies who are pregnant, ladies who are breastfeeding, that is, and apart from that, any other condition. Only condition where you have to be careful is if somebody has some allergies.
Yeah, please specify those things because public public of Nagaland wants to know in what cases we cannot take vaccine, in what cases we can take a vaccine. People are so confused and there is a lack of awareness in the society, and that is the reason why some are taking, they are coming and taking the vaccine. Some are so scared because of the negative news which is spreading all around. So if you all can specify in which cases we can take the vaccine, in which cases we cannot take the vaccine. If you all can specify that one, then it will be very good for the people to come forward to take the vaccine. So please.
All this information are out in the internet website, but just to specify a few, children below 18 years are not yet eligible.
Okay.
Then number 2 is people who has allergic history, allergy history, they need to be a little bit careful. So allergy to medicine or food.
Food
Yes.
and medicines.
Yeah. So they need to consult first so that it is doesn't aggravate their allergy.
Okay.
And so apart from that, all other conditions which earlier was thought to be detrimental has also been approved by concerned authorities. So right now there is not too many conditions for which the vaccine can be taken. Even say COVID affected person, after 3 months they can take the vaccine. So I think there are hardly anything that is impedance to taking the vaccine now.
Okay. Achha. So the specific that you mentioned, that is the person who is having allergy medicine, allergy, food allergy, these two, or you want to add some more?
I mean, food allergy, some have what we call allergic to chemicals. Yeah.
Sir have mentioned 3 diseases. In that cases, people can deny the vaccination. That is, if somebody has the allergy, food allergy, medicine allergy, chemical allergy. If somebody has this issue, they can deny the vaccine because it will be harmful, right?
They need to consult the doctor.
They need.
We verify what is their condition.
Yeah. If somebody has this kind of issue, they can consult the doctor, and the vaccination is completely voluntary. So you just consult the doctors, and if you feel that your body is ready to take the vaccine, you can come forward and take the vaccine, right, sir? So that's what Sir is saying, and so there are a lot of negative messages circulating around, and medical department have verified those cases. They are not coming forward in the media or in the newspaper. They haven't mentioned that this case, one particular person is claiming that because of the vaccination, they are facing these health problems. It's completely baseless, wrong, and it's because of this reason they are facing the health issue, like now Akram case. So what do you want to say about that?
I think medical department is doing their part. If you look at the newspaper or media or even the telephone ringtones, they are giving the information about the benefits of vaccine and all. In the midst of it, people have their opinion, both positive and negative. And people are entitled to their opinion because everybody lives by their conviction. But for the last more than 1.5 years, this COVID pandemic has affected so many millions of people, and many people have lost their loved ones. In the midst of that, one solution has come in the form of vaccine. And right now, after almost a year of its usage, its utility has been proven, and it has done good to the people who have taken, given necessary protection. So I think in the current situation that we are in, if there is a rope on which we can hang on to, I think it is something which is worth taking the vaccine. And with very few side effects the vaccine has, I think there should not be any hesitancy in taking it, because right now the solution is that we don't know what else will come in future, but this seems to be the helpline for the people. No? So I think that's what I'd like to say.
Yeah, I agree with your point. Completely agree with your point. But I really appreciate what the frontline workers are doing. I appreciate their work, and I pray for them also. But I'm talking about now, the particular Nagpur right now, we see a lot of negative cases, and still the negative cases, like the side effect cases, it's not highlighted yet. Though it's circulating among the public, but officials, concerned authority people, they are not giving official statement on those negative cases. So that's what I'm trying to say. Okay? People have come up. I have a lot of requests. They are saying my father is going through this kind of health disease after the vaccination. So these kind of cases coming up. People are working openly. In these cases, whether government is providing some concession, government is providing some compensation to those people who got vaccinated, who are facing side effects because of the vaccine. There are some cases, right? Few cases. In 100, there are few cases, but where we should go for the consolation, where we should go, whom should we approach? No? So people are confused about it. Like Akram Ali, they got vaccinated by some local somewhere. I don't know where they got vaccinated. They got vaccinated, and they become like that. But they were not knowing where to go, and they came to private hospital. According to wife's statement, they have spent a lot of money also in treating her husband. So in these cases, where we should go, whom should we approach? Please help me with that also.
See, the process is after vaccination, we observe the patient. No? And after that also we instruct that if they have any health issues, they can report to the hospital. No?
Which hospital? The particular hospital they have
It's not like that. Any health center.
Any health center.
Any health center, wherever they took the vaccine, they need to report for any adverse event. And there is a process where the adverse event is documented and is reported to the government.
Okay.
So there is a process in it.
Okay.
And after that, they will investigate what exactly is the problem. You know? And most of the events are treatable. You know? Mostly it's allergy and fever, but if there are something more, that needs to be reported, and
government will take care of it, I think.
Yeah, I mean there is a process of reporting it, and they have a process of responding to it.
Okay. Sir, I have clarified that if somebody has got any kind of side effect, or if somebody is facing any issue after taking the vaccination, they can report themselves to any local health center, or they can come to a civil hospital or any nearby hospital, and they can report themselves. There is a procedure. If there is any issue, government will take care of it as per the statement made by Dr. Clement. Right, sir? Okay. So thank you very much. Sir, any message for the public right now?
All I want to say is, COVID is real. No? It is not that hospitals are making up or something like that, because those vulnerable people especially, they suffer in the family. When I say vulnerable, means people who have some diseases, high diabetes, hypertension, people above 60, those are people who are dear to us, and they are the ones who suffer. No? So in order to protect them, safeguard them, if there is one available solution, I think it is good on our part, as we care for them, to opt for the option of vaccination and not be too skeptical about it.
Okay.
Yeah.
And would you like to say some few words to people who are like having allergy and they might not take a vaccine as of now? So in what way they can protect themselves from coronavirus?
Please use the mask, and I mean your hands should be always clean. Be mindful of that so that your dirty hands doesn't touch your face and airway area so that the disease gets inside you.
Okay.
And public places, as far as possible, please avoid, because crowded places, if one is positive and high viral load is there, that the virus can easily enter us. So those are the things we have to be careful about.
Okay. So guys, that the persons who have got this kind of, as Sir had mentioned, any health disease like allergy and the specified disease that I have mentioned, if you are not taking the vaccine, in this way you can protect whatever the instruction that Sir has given right now, you can protect yourself from in that manner. So keep that in mind and try to keep yourself safe. Because of our negligence, we get infected. So that's what I want to say, and I would like to thank Sir for giving us your precious time. I believe your precious words, whatever you have stated, it will be very beneficial for the people of Nagaland. So that's all I want to say. Thank you very much for your precious time once again. Thank you. So guys, মই এটা হস্পিটেল পৰা ওলাই যাইছে আৰু ভিডিঅ' এণ্ড নকৰেগে একটা দুটা কথা আপোনালোকে হাইলাইট কৰি দিব মন আছে ডক্টৰ পৰা কোৱাখান এইটো মই ভাৱনাটো থাকছে চবলা কনভিনিয়েণ্ট কাৰণে নাগামিজ পৰা ইণ্টাৰভিউ কৰিব হ'লেবি ইংলিছ পৰা ষ্টাৰ্ট কৰিছে আৰু এণ্টাক ইংলিছেই হৈ যাইছে এইটো কাৰণে মই আৰু একটা দুটা পইণ্টটো ইম্পৰ্টেণ্ট খান হাইলাইট কৰি দিব মন আছে তো ফাৰ্ষ্ট অফ অল মই ডক্টৰকে এইটো সুধিছে ব্ৰাদাৰ আকৰাম লা কেছ কাৰণে फैमिली पर तो ब्रदर अक्रम ला फैमिली पर को तो ताई वैक्सीन ला पीछे थे ही वैक्सीन ला पीछे थे ही ताई इन्हीं का पैरालाइज हुई को ना फैमिली मानु खान तो को ऐसे होली भी रिपोर्ट तो अलग दिखा से रिपोर्ट पर तो इतना आगे तो कौन सा CM ऑफिस स्टेज है इसलिए तो तहन पर तो को तो ये तो अंडरलाइन डिजीज करने हुई से कोई ना को ऐसे तो मैं अपनी लोते भी जानिव मन आसे सिंस अपनी ही ताइके ट्रीट करे तो अपनी के एक बार अपनी लोते जानिव मन आसे कि एक्चुअली हुई ताइके को ना कि कारणे ताई इनका बीमार होना से गुण होदिसले तो डॉक्टर भी तो डॉक्टर भी कोइसे इतो ब्रदर तो अंडरलाइन डिजीज कारणे और ताई पुला ला बीमार थाका ट्रीटमेंट नकरा कारणे इनका पैरालाइज हो जैसे गुना कोइसे तो और सेकेंड तो इतो মই পৰা তো তাইকে সুধিছে কি বেছি মানুহ খান अलग अलग বেমাৰ থাকে সব লাভ হেল্থ সব লাম বডিতে अलग अलग বেমাৰ খান থাকে তো কোন কোন মানুহ খান এটো ভ্যাকসিন লব পারবো কোন কোন মানুহ খান লব না পারবো এটো বি সুধিছে তো এনে তো নেতে গাইডলাইন্স খান ক্রাইটেরিয়াস খান দিয়ে না থাকে কোয়াছে হলিবে আজিকালি তো এটো কোন ফলো করেছে কোন বি ফলো নকৰে খুশি খুশিকে মাৰি দি আছে তো এটো বি মই স্পেসিফিকলি তাইকে সুধিছে একবাৰ মুকে এটো মেনশন কৰি দিবি কোনটো ডিজিজ থাকিলে মানুহ ভ্যাকসিন লব না পারবো সুধিছে তো তাই পৰা কোৱাটো কোনবা মানুহ এলাৰ্জি হিষ্ট্ৰী থাকিছে কলে তো লাইক এলাৰ্জি টু ফুড এলাৰ্জি medicine allergy, chemical allergy, yeah, different types of allergy we know, right? Makhan different अलग type allergy থাকে তো এনিকা খান কিবা কিবি আছে কুশকলে তো ভ্যাকসিন নলাগে ডক্টৰ কে কনসাল্ট কৰবি ইনা কৈছে এন্ড এটা আৰু একটা কথা মই তাইকে কনফাৰ্ম কৰা দিটো আছে কি আমি খান भी জানে আজিকালি ফেসবুক তে ইনস্টাগ্রাম আৰু জায়গা জায়গাতে আগে দে মই ভিডিও তে কোৱাঞ্চনা নেগেটিভ নিউজ খান সাইড ইফেক্ট লা নিউজ খান তো বেছি সার্কুলেট হাসি হলি বি তুলা তো কোতে বাৰ বি আনসারস না পায় আজি ব্রাদার আকরাম লা কেস হওয়া পিছে তে হি তাহান ক্লিয়ারিফাই কৰিছে হলি বি আগে তে কেসেস খান মান হৈছে হলি বি তুলা কো বি আনসারস না পায় না থাকছে তো মই এটো ডক্টৰ কে তো সিধা তাইকে সুধি লৈছে কি এনিকা কেসেস খান ওলাইছে কলে তো এনিকা आजकल न्यूज़ से भी दिखे से साइड इफेक्ट लाइन आसे ना नेशनल मीडिया ते भी दिखे से तो इनिया टाइम ते आमी खान नागा मानु खान तो आमी खान निजर मानु खान भी प्रॉब्लम फेस करे से तो कोते जायगे न कोन के मदद मांगिबो इनिका वैक्सीन ला पिछे प्रॉब्लम्स हुइसे कोते मदद करने जाबो ना মই तो भी हुदिसे वही बिकॉज अपने हान भी जानिबो ब्रदर अक्रम ला फैमिली भी ताई भी तखन भी ना जाने कोते जाबो ना ना जाने ना प्राइवेट हॉस्पिटल ते जायगे मान खर्चा करिसे ना तो इतो कारणे মই ताके खुदी लुइसे इनिका हो सकले तो कोते जाबो कोन के मदद मांगिबो न हुदिसले तो ताई पर ভেকচিন লোৱাৰ পিছতে এনেকুৱা কিবা কিবি ৰিয়েকশ্যন হোৱা আছে সাইড ইফেক্ট হৈ আছে এনে আৱশ্যকলৈতো আপুনি হান নিয়াৰেষ্ট হস্পিটেল ইয়া ক্লিনিক কিবাতে আপুনি হান যাই কিনে ৰিপৰ্ট কৰিবি আৰু তাতে প্ৰচিডিউৰ আছে প্ৰচিডিউৰত আছে এইটোখান চব চেক কৰিব চব চেক কৰি না কিবা কিবি প্ৰব্লেম থাকিসকলৈতো গভৰ্ণমেণ্ট পৰা চাই ল'ব কিনে তাৰ পৰা এনেকুৱা কথা জনাই দিছে তো এইটো কথা আপোনালোকে জনাই দি আছে So that's all I want to say for today. Thank you very much. God bless you all. Stay safe. I'll see you all in the next video.